Thank you very much, Otto. Good evening and welcome to On the Table. Tonight, in conjunction with Cervical Cancer Awareness Month, we catch up with Associate Professor Dr. Muralidharan Munisamy, the Managing Director of the National Cancer Society, Malaysia. Welcome back to the program, Doctor.
Thank you, and such a pleasure to be on again.
Thank you. Now, Dr. Murali, the last we spoke to you, it was just after the launch of NCSM's initiative, Leaving No One Behind, Eliminating Cervical Cancer in Malaysia. Now, before we move on to the progress of that program, can you remind us about what cervical cancer is and its prevalence in Malaysia?
Absolutely. So cervical cancer is still a very dangerous cancer among women. It's the third most common cancer among women in Malaysia. And what's really sad is less than 3 out of every 10 women who get the cancer in Malaysia live past 5 years. So it's really something that's afflicting our women. And we can do something about it.
So this is the cancer of the cervix.
This is cancer of the cervix, which is basically an organ every woman has, and it's not the ovary and the uterus, different types of cancers.
Those are different types, yeah.
Yes, and it's quite a common cancer among women after breast cancer.
I see. And in Malaysia, you said it's the third?
It's the third most common
cancer in Malaysia. Okay, now, Doctor, what has happened since the launch of the program, Leaving No One Behind, Eliminating Cervical Cancer in Malaysia? It's been about 2 months now.
It's been about 2 months, right, and so in this time, we've been keeping busy.
Right. You did mention that this is something that's going to go through all the constituencies, and that's how it's going to roll. So tell me what has happened since.
Absolutely. So how are we operationalizing the program? It's actually through 3 different kind of approaches. So one, of course, we're working on a formal level through the elected member of parliament, and then through their office, we're actually organizing ground level briefings with constituencies, agencies, NGOs working locally. So with them, once we brief them on the program and who are the possible recipients, and then they start organizing sessions in which they bring this possible recipients to actually get vaccinated. But at the same time, there's a pocket of people, for example, those who are ill and at home, those who are disabled, and these are really not people that sometimes are not touched by these groups. So to them, we go and actually organize a mapping of the constituency, these areas, and then we give them the vaccine at home.
Okay, so what's the progress looking like right now? Like how many constituencies have you started working with?
So we're working in the first pilot about 22 constituencies out of the 222 constituencies. So we're getting it done in batches, and we're hoping that right after Chinese New Year we'll actually expand into a bigger pocket and cover much more states. Okay,
any particular states you're like, are you going up north first or south? Or?
So technically we're planning to do the north of Malaysia, Sabah and Sarawak. We're expecting Sabah and Sarawak will take a long time to do.
So because of the remoteness?
Absolutely. So there's going to be separate teams working in Sabah and Sarawak, and they'll be running for at least about 6 or 7 months. But in the peninsula, we're starting up north and south, and then gradually we'll and subsequently after that, the east coast, and then gradually kind of move towards the center of the Klang Valley.
What is the reason for that strategy? Why are we going this way? Why is the Klang Valley the last?
Okay, so the Klang Valley actually for us is the easiest geographically, and of course with good infrastructure, and most importantly awareness. So people here are a lot more aware, a lot more cognizant. They will kind of be very easily it'll be much easier to get them to get to the vaccine. We expect that in the remote rural more areas of the country, there's going to be a lag time between getting people convinced to take the vaccine, arranging for vaccination sessions, and actually getting it done.
So the challenges would be a combination of more of awareness in terms of awareness, and also the remoteness of the geography.
Absolutely, because those are the groups that we're targeting. We're also being very careful. We want to avoid kind of running into the flooding months towards the latter part of the year if you're stuck on the east coast. So if you've done all of that in the earlier months, then as we move to the more center of Peninsular Malaysia, it'll be geographically easier as well.
Okay. Now, Doctor, in 20 2020, the WHO set a goal to eliminate cervical cancer, and this rests on 3 pillars, which are vaccination, screening and treatment. Now, we've spoken about vaccination and the work that the National Cancer Society Malaysia is doing. Can you explain about screening for cervical cancer? Now, who should be doing this and how often?
Okay, so generally screening is something that is divided into kind of 2 different types. One actually is a little bit more downstream, I would say, and this is what we do in terms of pap smears.
Okay.
Okay, pap smears are very common. We've recommended it for women. Usually, I mean, even you can start as early as your 20s, then all throughout your kind of reproductive age until you reach menopause, kind of get you until about your 50s, and subsequently after that into your late 50s onto your 60s. Right. People are still encouraged to kind of get their pap smears being done. Before this, we asked people to do pap smears every year.
That's right.
Now we've come down to
changed.
3 yearly. So you only need to do it 3 years once.
What is the reason for that exactly?
So to be honest, it's actually been because largely driven by the fact that one, we don't need to over medicalize.
Okay.
We don't need smears as often, so it saves quite a bit of cost.
Okay.
But also people have been very reluctant to take it up because it actually is quite invasive.
Yeah.
And you actually need to put a tool into your cervix and kind of take out a sample, and then from there you look at the tissues and you see whether the tissues are actually giving you some kind of abnormal cells.
Okay.
So what is new? I would say relatively new in Malaysia, about 10 years, is we've got this new technology. Again, I use the word new very loosely, called HPV DNA. HPV DNA works a bit more upstream.
Okay.
So for one, a lot of the technology around HPV DNA is allowing it to be self-testing. So the lady can actually do it by itself. And the second thing is it detects HPV, the human papilloma virus.
Okay.
So it detects whether you have an infection, and this is so much more earlier than if you actually had abnormal cells.
Okay.
So if you can detect this much earlier, you can do something much more earlier about it.
Right, and this is relatively new?
I would say about 8 to 10 years.
Okay.
But we're still slowly kind of digesting and getting around to it. So it's a lot more popular now. The Ministry of Health has it. The government has it through other agencies like LPPKN.
Okay.
There's colleagues of us in Program Rose, for example. That's an NGO that's going out and doing HPV DNA testing in the community. And of course, we do both HPV DNA and pap smears, depending when and where and how people like to kind of get their testing done in terms of cervical cancer screening.
Okay. Now, Doctor, I'm curious, can cervical cancer be completely cured via treatment?
Absolutely, and what's really interesting is, unlike some other cancers, cervical cancer, we pick it up in the HPV DNA stage, you can do something about it, and then of course when you pick it up in a pap smear, we can actually pick it up at stage 0. Where, we always talk about stage 1, stage 2, stage 3, stage 4.
That's right.
We can actually pick it up in stage 0. And at that time, you can actually excise away that area of abnormal tissue, and this person goes on to never get cervical cancer ever again. So it's a brilliant thing that we can do for cervical cancer in terms of stopping it in its tracks.
But that's if you catch it early. Now, what if it's stage 2 or stage 3? Can it be completely cured?
Absolutely. At stage 1 and 2, we're still looking at long-term remission. You'll notice doctors hate to use the word cure for many cancers.
That's right.
But you can go into long-term remission where you never actually have the disease once again. The challenge is in Malaysia, more than 40% is diagnosed in stage 3 or 4. That makes it difficult to treat, more expensive, and of course, a lot more, life-threatening to the person who gets it.
Now, Dr. Murali, I've seen reports which have quoted you saying that we are seeing higher rates of nasopharyngeal cancer, or NPC, in the country. Can you explain this cancer's link to HPV, and can the HPV vaccine prevent that cancer as well?
Okay, so HPV, as you know, is a virus,
Yes.
and it transmits
Yeah.
both within males and females.
Okay.
And of course, like how to say, the most common cancer caused by HPV, cervical cancer, but it also has a link to anal cancers, rectal cancers, and now as you're quoting me, I've said it enough
Yes.
as well, that it's quite related to nasopharyngeal cancers as well, because there is a kind of link between the infection,
Right.
both anywhere in different parts of the body, and then people pick up cancer from there.
Which means HPV can affect men as well.
Absolutely, absolutely, and
So why are we not vaccinating the men?
so
There's no need for it?
No, so in some countries have already gone into like Australia vaccinates both boys and girls.
Okay.
So we're slowly moving up to that.
Okay.
So our task is first let's get all the girls covered,
Right.
and then we'll slowly move towards covering the boys as well. This has been both the direction by WHO to different countries, and of course as we get the resources, we're kind of getting this done, one step at a time.
Good. Now, Doctor, let's touch on the rising cost of care for cancer today. What can government, private sector, and NGOs like yourself do to ease the financial burden, especially when it comes to cancer drugs? Because as we see right now, we're talking about the cost of drugs rising, and what can we do about that?
Absolutely. A very, very difficult phenomenon. When I started school, curry puff was 10 cents. Now it's like 1 ringgit and you still can't get a decent curry puff. Problem is medical inflation, it has been a lot higher than normal inflation. And so the price of treatments, drugs included, have just skyrocketed over perhaps even the past 20 years.
Yeah.
The rise every year is very high.
Yeah.
So the government has been doing things around it. For example, trying to expand more services, facilities. But as you can see, we are not in stable economic times.
That's right.
So a lot of people who previously had health insurance due to COVID, post-COVID times, they've actually lost their health insurance, and that has now necessitated them to go to the government sector for treatment, again overburdening like already congested government facilities.
Actually there was a question I wanted to ask you about. Do you think there is enough health insurance literacy today among people?
So unfortunately it's a big challenge.
Yeah.
People take insurance. We're slightly better now, just keeping in mind that only about 22% of Malaysians actually have health insurance. So I think people don't still kind of grasp the need for health insurance. A lot of people are taking insurance. The problem is people often get mixed up between life insurance and health insurance, medical insurance. And the problem with life insurance, a lot of people have life insurance, but it's not useful when you're alive practically. So in terms of getting money for treatment, that is really a challenge.
And I hope health insurance literacy actually picks up and more people are aware of what they're actually getting and get the proper treatment and cover the costs that they need. Dr. Murali, thank you so much for your time today, and I'm afraid that's all the time that we have for tonight. We wish you all the best with the HPV vaccination campaign.
Lovely. Thank you so much once again. Good night.
And that wraps up Malaysia Tonight. I'm Mohana Priya with Otto Othman. From the river to the sea, Palestine will be free. Thank you for your company. Good night.